Good morning, one and all. As this is the first meeting of Scrutiny Committee following annual council, we need to have an election of chairman, which I'm presiding over. Can I please have your nominations for chairman?
I'd like to nominate Councillor Mumford.
I'll second that.
And do I have any other nominations? I do not, in which case can we go to a vote, please? Or please raise your hands. Or not, that's unanimous, fantastic.
Thank you very much, everyone. Good morning to everybody online. Good morning, Phil. Good morning, Nicola. And good morning, Sue. And good morning, Jeff. Now I'd like some nominations for Vice Chair, please.
I'd like to nominate Councillor White.
Thank you. Could I have a seconder, please?
I'll second that.
Thank you, Councillor Marcus. All those in favour? Oh, sorry, any other nominations? No. All those in favour? Unanimous. Thank you. Thank you, Jeff, even though you're not here. For the last item on this, as I'm the lead member for adults, I'd like to ask someone to take that last item. So I don't know if anybody's willing to stand up and do that, because Jeff can't do it really from up there. So, Steve, would you like to take the chair just for the last item, or aren't you going to be here?
I may not be here. I don't mind taking it if I'm here, but I've got to go at just before 11, and then I've got to go just before half 12.
Maybe we'll ask Lynn, because I know Lynn will still be here. She's been previous. Is that all right with you, Lynn? Okay. Thank you. Right. Declarations of interest. I have none. Consider the draft minutes from the last meeting on the 23rd of April 2026. Any comments?
I'm happy to propose them as accurate.
Thank you. Could I have a seconder, please? Councillor Blackwell. All those in favour? Unanimous. Thank you. We now come to part one, and could we have agenda item 6, progress update on Children's Services Improvement Plan. I'd like to ask Sue Butcher if she'd like to present this.
Thank you, Councillor Mumford. Can everybody hear me?
Yes, we can.
Good, good. So this is the first progress report on the improvement plan being provided to Scrutiny following my appointment at the beginning of March. And so the improvement plan sets out specific actions required across 4 key areas. Very much the right help at the right time. So strengthening early help services. So we don't, so that we can prevent moving into statutory social work services. The child's voice and social work practice. It is important through all that we do, that we listen to the voice of the child, listen to the voice of siblings, listen to the voice actually of parents.
Sue,
and of course, sorry?
Sorry to interrupt you. Have you got a mic there? You're a bit faint.
Let me see if I can do that.
Sounds better.
Is that any better?
Yes, that's better. Thank you. Sorry to interrupt.
Not at all, not at all. So child's voice and social work practice, absolutely important that we...
Again.
Has it gone back again?
It's gone again, sorry.
I think it's the system. Okay.
It may be the system. Can you get closer to the microphone? Try that.
Is that any better?
Well, that's lovely.
Oh, let's hope it holds out. Okay, is that I will endeavour to still better?
Yes.
Good, good. Thank you. I'm not usually not heard. I'm usually very loud. So, but we'll carry on. Effective services and provision.
Oh,
So we coordinate. Is it gone again?
yes, it's coming and going. You may just have to shout.
Okay, any better?
Yep.
Okay, I don't quite know where it's fading in and out because okay. So leadership, oversight and quality assurance is obviously really making sure that the quality of our practice is where we need to be. So the revised improvement plan, as people may know, when I came, I felt that the improvement plan was not where it needed to be. So I significantly revised the improvement plan with the advice and with the with the approval of the improvement advisor. So we re-baselined all of the actions because some of the actions were seen as complete, but they were complete a long time ago. And what's happened since then? So I reallocated improvement appropriate leads. I amended some actions, and what we hadn't done, and I think some colleagues are probably fed up with me saying what we hadn't done is look to impact. And we found some progress. And so we found that safeguarding practice is improving,
I know.
albeit, no, can't hear me?
Yes, keep going.
Okay. Safeguarding practice is improving, albeit from a low base. And we have more timely intervention and stronger meetings. Thank you, Phil. So you can hear me and Nicola can hear me. It's the room. Okay. Partnership working has also improved. And we are liaising with agencies, for example, with the school. A social worker is going into the school on a regular basis. Leadership and governance is more stable. As you know, my role is permanent, and we also have a permanent head of service and a stable social work cohort. Delivery has been strengthened, and we have a more project manager approach to things. And certainly Kilner is helping with organising things into those project plans. And we've made refinements in terms of tracking individual items. So, however, progress lacks the necessary pace at the moment, and there is limited evidence of the improvement activities and particularly of impact. So we have a focused period of activity, and it's been initiated to strengthen available evidence through the improved coordination. And this specifically, a specific item here, is the quality of records on children's files. Records are there, but they are not always purposeful, and they don't always evidence the voice of the child. And as I've already alluded to, the voice of the child, the voice of the family is really important. So the pace of improvement must increase ahead of the Ofsted inspection, which we expect in the autumn. Financial pressure remains a risk due to additional capacity and expertise. So that's really an overall of where we are. I would say that there are some social work basics that we need to improve. We need to improve impact. We need to evidence impact more. And we need to make sure that the children's file really evidences the work that's been done and in terms of impact for the whole plan. So in terms of the recommendations, if members can comment on the revised improvement plan and really acknowledge where there's progress, although it's limited. And I know that I have members' support in terms of taking the plan forward, but I'm always open to challenge, oversight and support, particularly in terms of the capacity for improved pace. Thank you, Chair.
Thank you. Any questions? Councillor Dean.
Yes, thanks, Sue. You've had a little dig, I think, in the report where you've said that this would normally go to the improvement board before coming to scrutiny. So I think we need to bear that in mind for the next report. The other thing I wanted to just delve into a bit is you mentioned the mosaic system, which is expensive, and you've said in the report that the functionality and reporting are still in their infancy. Is that code for it's not really working to its full advantage, you know, to its full capacity, to its full potential yet. I'm hopeful that it will.
I think I think there is some aspects of functionality on Mosaic, which might be on other systems, but not the system that we've got. I also think that there is something about how we are using Mosaic. So, for example, going to the improvement board, we haven't had a very good scorecard, and that's been something that the improvement advisor has focused on. However, when you deep delve into it and look at what we need, it can be extracted. So there is something about possible future revisions to the system, although I don't think we have time to do that before Ofsted. But there's also about the increasing use of, the increasing depth of use of Mosaic at the moment.
Okay, thank you.
Thank you. Jeff?
Thank you, Avril, and thank you, Sue, as well for the report. I mean, it reads from the report as if the improvement plan has been very well revised now. I'm happy to see, you know, that actions have been reframed as SMART goals. But it does beg the question of why that wasn't the case in the first place. I mean, it sounds as if the previous improvement plan could be considered a bit of a tick box exercise in the way it was set out, with actions completed and then not revisited. Whereas it feels to me as if this refined version will be more of a living document, so ripe for revisiting or reviewing actions to ensure progress. And the fact impact is now going to be evidenced and measured is very welcome, although it's disappointing it wasn't done previously. To me, overall, it feels as if the permanent leadership we've long needed is bearing fruit now it's in place. And despite the negatives contained in the report and our recent Ofsted monitoring visit, the tone of the report to me feels very promising going forwards. I know we all hope and expect improvement is reflected in our next Ofsted visit. How do you feel things are going in that respect, and how much of an asset will the new improvement plan be in achieving that improvement?
I think what we've done now in children's is to baseline. So I think the improvement report sort of baselines where we are in terms of improvement. And so, for example, we also have an audit report now, which, you know, there is a room for quite a lot of improvement in practice, but we've baselined where we are. And so we've also identified where there are reasonably quick wins. So, for example, to give you a quick example, we're not liaising with fathers as much as we should do in some of our social work practice. So actually we can start that really quickly. You know, we don't have to wait around to do that. So yes, we need to have, we need to move now with pace. And I think that's extraordinary. I mean, Ofsted, we don't quite know when they will come, but the main, I suppose I've added pace to the end, evidence, impact and pace. Haste isn't pace. So I don't want to, you know, throw everything at it over the next month or so. What I want to do is pace us through, and the improvement plan will help pace us through. Yeah, I think that's probably it. The old plan, you're right, was, as I said, a bit tick boxy, because if something was completed in 2024, you don't know that it's still, you know, and change is not linear either. And I think also, you know, things were ticked in the box that said draft, so you can't have that. But nonetheless, it's been quite a bit of work to rebase the plan. And maybe in some ways that's also slowed down actual progress, because we're actually working out exactly what we've got to do. But thank you for your observations.
Thank you, Sue.
Thank you, Sue. Councillor Blackwell?
Thank you, Chair. Hello, Sue. Just one
Hello.
question. Hi. Are you confident you currently have adequate staffing to carry out the revised plan?
That's a really good question. And to be honest, at the moment, I'm not quite sure. I think we need, I don't think we need any more social workers, and I don't think we need any more, another head of service, for example. I think if there is a need, Councillor Blackwell, it's for early help workers, the workers who work before things tip into social work intervention. So if there was, if there was available finances for that, that's probably where I would go in terms of that, so that they would be really focusing on the voices of children and young people. So I think that's probably where I would look. In terms of audit, at the moment, I think we have sufficient auditing capacity. Again, as we move towards the actual Ofsted inspection, it may be that we need more at that stage, but I'm not looking for that. At the moment, we are recruiting for a business support officer. We do have applications, and that is pretty crucial in order to support practice, so social workers and workers in the service, and that's across adults and children aren't doing their own basic admin.
Thank you, Sue.
Councillor Marcus.
Yeah, I was going to ask a question kind of related to that. You said about the mosaic system not being deeply utilised enough at the moment, and we're also you're talking about the quality of recording and how that's being monitored and making sure that the children's voice is coming through that loud and clear, which also kind of, and those two things together kind of highlight the paragraph 5.3 where it's talking about there's enough funding for the steady state, but if we need to commission additional interim expertise, that would have to be managed. So in terms of auditing and quality assurance, I think you've probably just answered the question, but it's just probably worth, I don't know, just reiterating that the work needs to be monitored as well. Is that correct?
Yes, I'm sorry, Councillor, I probably didn't explain that very well. I have brought in some additional audit expertise already, and he's done a whole set of baseline audits, and we'll be coming back to do that monitoring of audits. So for example, with audits, he will be providing us with a tracker for actions against individual audits, which he will monitor, and he's a very competent auditor who is, who has gone through lots of Ofsted inspections. So I do have some additional, and I would say probably more proficient audit expertise. I think with regards to the recording and the probably deficits in recording, I don't think that's anything to do with Mosaic itself. That's some of the basic tenets of Mosaic. So I think that is much more experience and reflection.
Thank you. Thank you. Councillor Grottick.
Thank you, Chair. Can I ask, post Darcy, if you're comfortable that we're striking the right balance between prevention and practice? Do you think that we are making the right choices as we move forward, given the resources that we have? Are you comfortable, may I ask?
No, thank you. I think I would appreciate more early help, as it were, that early help, that preventative work. We do some, and we do some in conjunction with partner agencies. And I would say that our relationship, in my view, with partner agencies is improving. For example, we're going to be meeting with the police on a monthly basis, or I think it's monthly, to look at where some issues lie. We're meeting with the school more frequently to tease out ideas of how we might do preventative stuff. So, for example, a social worker going into a school on a regular basis and being with the children. So I think that there's some more coordination of early help needed, and that would then even up where we need to be. I hope that's helpful.
Thank you.
Thank you, Sue. Any more questions? Councillor Dean.
Not really a question. I'll just carry on from what Councillor Grottick, or what you just said about multi-agency work, and that's really good to hear that there's positive feedback from other agencies, and they're attending the meetings. I know in the past that's been an issue, so that's really good to hear. So well done for that, and I will propose the recommendations.
Thank you. Do I need to read the recommendations out? No. Could I have a seconder, please?
I'll second them.
Councillor Marcus. All those in favour? Thank you, Sue.
Thank you, Chair.
We move on to agenda item 7, which is the fire and rescue. Hi, Phil.
Good morning, Chair. Good morning, members.
Paper, please.
So I present this paper seeking your support for us to adopt a 5-year community risk management plan for the Isles of Scilly Fire and Rescue Service. The CRMP is a statutory plan that sets out how we assess, manage risk and protect life and property and the environment. What we want to do is move from a 3-year cycle, which will strengthen long-term planning, align our alignment with partner agencies and provide greater stability in our priorities. This change will not reduce flexibility. The plan will be reviewed annually to ensure it remains responsive to emerging risks and community needs. Producing the CRMP in-house also makes best use of our local expertise, and importantly, it avoids external costs. This is a practical step that supports effective governance and a resilient risk-based service. I welcome your scrutiny of the report and recommendations, and I invite you to support the proposed transition to a 5-year CRMP cycle.
Thank you, Phil. Councillor Dean.
Thanks, Phil. Nice short report, always like that. As you've just said, very practical. The basis for it is just sensible, isn't it? So I'm more than happy to propose the recommendations.
Councillor Grotty.
I second that, and thank you for this succinct and comprehensive report. Thank you.
Just a couple of questions, Phil. What are the financial implications of changing from a 3-year plan to a 5?
Well, you'll be pleased to hear that it's cost neutral and potentially it's positive. If we produce it in-house, we avoid the external consultancy costs. Previously, the work was carried out externally and at cost by Cornwall Fire and Rescue Service, and that did reduce some of our flexibility. We can deliver it within existing resources. If there is any future investment need identified by the plan, that would be clearly set out, and then it would come to council or through the normal budget setting process.
Thank you. And do we have the expertise to produce the CRMP ourselves?
I'm confident that we do. So the service has got the operational knowledge of the risks and incidents. I myself have produced CRMPs in the past for other services, and we also have the skills and expertise in the council to carry out an effective consultation, which is a requirement of the plan. We've also got support from Essex County Fire and Rescue Service, who've helped us to come up with the shape of what we're doing at the moment.
Thank you, Phil. Any more questions? Jeff, did you want to come in or?
No, you asked the questions I was going to cover, so that's all covered.
Okay.
You got there before me.
Well, we've had a proposer and a seconder. All those in favour? That's carried unanimously. Thank you very much, Phil. We'll see you at a later date.
Thank you.
Thank you very much. Right, agenda item 8, the housing delivery, in the hands of Nicola. Hi, Nicola.
Good morning, members. Just a short report, really, just highlighting where we are in terms of housing delivery in relation to the housing crisis that was declared back in 2022. You know, housing crisis is when we don't have enough demand, we have more demand than supply. And what I want to do is to bring to your attention what's happened sort of in the last 12 months or so in terms of delivery. Need's not really changed much. We've got some further evidence around need. The original local plan has stated the need for 105 homes, and in over 13 years we've delivered about 26 or on site or completed, so we're only delivering about 2 homes a year, so insufficient to keep up with that demand. We are continuing to collect data around need, but what was really important recently was the Housing and Economic Needs Survey was undertaken to understand the wider context of need, because sometimes we just capture it through the Social Housing Register or the Transfer Register, but the Housing and Economic Needs Survey that's been done for local plan captures that wider cross-island needs and looks at what the economic demands are and how we can support that through housing delivery too. So a really important piece of evidential work that Lisa, as Chief Planning Officer, has been undertaking as part of that local plan preparation. And what that's clearly identifying is there's definitely a demand for over 100 homes over the next 10 years. So what we're going to do about it. So I think I've set out in paragraph 11 where we are in terms of the sites we know at the moment, and there's some key updates there. Some are still dependent on funding, and we are working closely with funders and with other stakeholders and partners to deliver homes. But what's been great, I think, over the last period is seeing the Duchy step up to the mark and deliver more homes on the islands, and also working with Live West on the Carn Thomas site and Homes England to try and bring that forward. And of course, the old museum site, once the lease is signed with the Isles of Scilly Museum Association, which should be very soon for the new town hall development, we should be able to put that to market too. So there is some progress. It's slow and it's challenging because of the barriers, and those barriers really relate to the financial viability of delivering homes on the islands, and the risks of doing so. What's really important is bringing partners together to help us deliver, because we can't do this on our own. And there is a key workshop that Homes England are hosting for us on the 23rd of June, whereby Homes England are looking to fund a housing delivery plan for those 100 homes, but alongside that delivery plan, looking at a new delivery funding model for the islands, a bespoke model for the islands, because whenever we put applications through the Homes England model, it always comes out the other end going, this doesn't fit, no news there. So we'll be looking at how others have been able to work the system to their advantage and get Homes England funding, but also looking about what the bespoke solution is for the islands, so we don't have to have the same argument every time when we put an application in for funding for works on the islands. So that's a really positive step, I think, and a very proactive step by Homes England in helping us get to delivery over the next 10 years as well. So there's stuff on the ground at the moment. There's stuff shortly to go on the ground this year, and then we need to look forward to how we plan for the next 10 years and tackle those barriers as quickly as possible in partnership with others. So there's still a lot to do. We do understand the barriers, but we are supported by partners in a very positive way at the moment. So we'll maintain those relationships and continue to seek to get delivery, which will help us sustain the island's economy and population as we move forward. Thank you, Chairman.
Thank you, Nicola. Councillor Dean, would you like to say something?
Yeah, thanks, Nicola, for the report. I mean, we talk about it endlessly, don't we? So none of this is really news to me. But this workshop with Homes England is really important coming up, because, as you say, every time we come up with a plan and we try to get it funded, it doesn't fit the mould, and you know, we just go round and round and round in circles. So that's very encouraging. As you've already said, the Duchy stepping up is very encouraging. There's rumours about another development after they finish the ones up at Telegraph, so hopefully that will come to fruition. Hopefully that will be social housing, which I think is our biggest need. The other point I wanted to make, and you kind of touched on it really, was when we declared the housing crisis in 2022, it was a very urgent need. It was a very, from my mind anyway, at the time, it was that there were families that were going to have to leave the island. It was you know, it was crisis time, proper crisis time. I don't think we're in the same place now, but I think the crisis has developed into a wider crisis, and I think we're all seeing the evidence that, you know, if we don't address this problem, the Isles of Scilly will become unviable going forward, because there won't be enough people living and working on the islands to support the community that we need. And that is now the crisis, I would say. And we have to keep the pressure on to deliver these houses. If all these ones come through, excellent. It's a massive step forward, but I don't think we can just stop there. There's probably a few more to build. And the other point that we really need to stress is that we need to keep these new houses where they should be, being used for what they should be, which is as primary residence for people who are living and working on the Isles of Scilly, not second homes, not holiday lets. There's probably room for more holiday lets, but this housing that we're talking about here today needs to remain as primary residences, but to support the economic future of the islands. So, thank you.
I would agree with all of that. Any more questions? Councillor Blackwell.
Thank you. Thank you for the update, Nicola. I've just got some comments on one question. Thank you for sharing the report, which I will comment on. As members, we have to be pragmatic and practical in considering essential needs against want. New builds should be proportionate to need, but we need to be highly sensitive to other factors which have a knock-on effect in the community. The findings of the report are not the whole picture, as it does not reflect on the impact on the environment or our fragile infrastructure that an increase in housing estates might have. For example, we have no community public transport, so can expect on average one additional car for each house built. Our brand new care home does not accommodate any more people than the previous one. Our supermarket capacity is limited, and our job market on the islands is extremely seasonal, with an increasing number of jobs leaving the islands and being carried out from the mainland or beyond. There are a finite number of full-time year-round jobs here. We must ask ourselves, should we continue to build on greenfield sites, or should we address the damp and mould in homes noted in the HENA report? Whilst new houses create council tax income for the council, so we are always encouraged to build, the pressures that can come with a new housing estate are not something that can be taken lightly. There is a fine balance on the islands between environmental impact and housing. It is interesting to note that the housing register has 41 applicants on the list, and there are 37 homes currently being built on the islands, so we are making good progress in terms of housing need. As Tim has said, the word crisis appears a little exaggerated at this point in time. We have recently changed the way tenancies are managed, and new agreements are assessed every 5 years with regards to occupancy. Underuse of homes should be considered alongside overcrowding. This improved management should ensure housing is matched more appropriately to need going forward in the future. So with the above in mind, what other measures, other than building new homes, can we take to ensure our current housing stock is utilised to its maximum?
Thank you, Lynn. So I think there's a number of things that sit together with this new delivery of homes, which is about how we manage our existing stock. And we do incentivise people to downsize where that's appropriate. And we support people in doing so. And that's an existing council policy. I think the difficulty we sometimes have is that there aren't the right size homes available. So if you look at the need within the surveys, it's primarily around 1 and 2 bedroom units, whereas supply on the island isn't necessarily the 1 and 2 bedroom units. So the focus of the new builds is around that key area of demand, which will allow people to downsize into appropriately sized properties. So I think this is part of the solution. It's not all of the solution. But a lot of people feel very loyal or very tied to their existing property. So it's difficult for us to make people move from, say, a 3-bedroom property to a 1-bedroom property. What we can do is make that as attractive as possible by creating new homes that are better insulated and cheaper to run. So I think there's sort of a carrot and stick here, isn't there? So we have to work alongside our tenants and what their needs are. I agree with a lot of what you've said as well around, there isn't a single solution. I wouldn't necessarily agree that more homes mean more cars, because the current supply and new builds relate to meeting existing housing demand on the island. So, and the plans in the new report for the local plan also just look at sustaining the existing population. So this isn't about population growth. This is about meeting the needs of our current population who are already on island or working on island. So I don't necessarily agree that it will increase the number of cars on island, because at the moment, this level of development is to meet current housing need, not for population growth or economic growth. It's really just to sustain our current position.
Thanks, Nicola. Just coming back on that, well, I think the location, in terms of cars, the location is quite important. So if they're out in country, they've got to get back to town, so potentially increasing cars. But thank you for your response.
Thank you. Councillor Marcus.
Yeah, just thank you, Nicola. Just ask a question, provide a bit of challenge. In paragraph 6, it talks about the housing register, and currently in that table there's 41. The current need is 41 households. Previously, it says in July 2024 that was 78. How come? What do you think that drop is due to?
I think there's a number of factors. One is that we require people to re-register each year, and when there's no availability, people tend not to bother registering. And I think once people see the new houses being built at, say, Con Thomas for social housing, I think we'll see an upturn in the number of people on those registers. So I think it's a bit like the self-build register, that's gone down because people that they don't believe in things until it starts happening on the ground. So I expect that demand will increase. I think the other thing is we're losing people from the islands at the moment, so we're depopulating. So rather than joining the housing register, people are moving to the mainland. So I think we need to get the message out there is once we start getting new homes being built, is it's entirely appropriate to join the housing register because there is hope then that there will be houses becoming available for allocation. So we have seen a reduction of people on the register because I think there's been a lack of hope about that being a useful way of getting a home. And also, if you think about the employment of staff for, say, the care home, we've been using agencies, so we've been using private rented single rooms in properties. If we're to get a full-time workforce based on island, we need a household, a home, not just a room. So I think that will put some additional demands on services, on our delivery requirements as well. So a bit of a mixed picture. We haven't delved too deeply into the reasons why, but I would expect an upturn in applications as for example, the Con Thomas site starts in the autumn.
Yeah, no, that sounds sensible reasoning to me. I was thinking it's like a self-fulfilling prophecy, isn't it? But positive feedback, Luke. If there's nothing there, people won't apply. And I'm doing a quick bit of maths. In your table, there's 78 potential properties on St Mary's alone, which would be amazing if that comes off. I mean, obviously there's going to be repercussions of that in terms of transport and infrastructure and facilities, but if you don't use it, we'll lose it. So we need to make sure that we've got people here to run the services that we need. Thank you very much, Nicola.
Councillor White.
Thank you, and thank you, Nicola, for the report. I mean, I'd echo the comments made by other councillors here. I think we all know we have interconnected problems on the islands, and these need looking at and addressing in the round, and housing is a very important part of that, but not the whole. Just similar to Councillor Blackwell, I've just got a couple of comments and then a question. Unfortunately, there aren't any surprises in the report. I think it's only disappointment that it's taking so long to get badly needed houses built. And we all know the difficulty of securing funding for new build properties on the islands when our costs are so much higher than the mainland. One of the main drivers of those is, of course, freight costs. The increase in partner working is promising, as is the increased work with Homes England. I hope that bears fruits. That sounds very needed. As noted in the report, the Duchy seem to be making great strides despite some of their older properties causing them difficulty. In terms of our own sites, I think you've answered this about one of them already just now, but how confident are we about delivering the Carn Thomas site and the Enel Farm site?
Yeah, so I think the Carn Thomas site is almost over the line. It's with Homes England. The business case has been written, so it's a partnership, again, a partnerships arrangement there because it was our land. We've then sold the land on to Live West, and we're working with them and Homes England to get that site brought forward. They have a preferred contractor who is already on island, and they're keen to move from one site to the next, so they're keen to start in the autumn. We're putting pressure on Homes England to get that funding agreement in place to allow that to happen and allow the logistics and the arrangement of freight to take place as soon as possible to make sure that start on site happens this year. Some of that's within our gift and some of that isn't, so all we can do is act as a sort of facilitator, an influencer, and work on those relationships to make sure that everyone understands the priority need that we have to get that site underway. I think the Enel Farm site's again challenging. It will depend on some further funding becoming available. The reason why we've started that site and used some of the funding is to make sure we retain the planning permission, but also the funding that was provided through Land Release Fund to help us get at least a start and maybe a first phase away. It does need some further work, and that'll be one of the challenges we'll be discussing on the 23rd. Self-build's always very difficult. And it might be that we need a different model there, but part of that delivery plan that we're going to be working with Homes England and partners on would be looking at, how do we do it? So it's not just the finance, it's all the other things too. So how do we make it work? Is it a different model? Is it a mixed model? Do you have to put some private sector homes on there to cross-subsidise the delivery of affordable homes? So it's really useful working with those who've had experience elsewhere. I'm not saying their models always work, but it's useful to bring that to the table for at least a discussion in the island's context.
Thank you, Nicola.
Thank you.
Any more questions? No? Can we have a recommendation that members note the findings within the report and discuss any further actions they consider the council can undertake to support housing delivery on the islands? Could I have a proposer, please? Councillor Dean, seconder. Councillor Grottick, all those in favour? Thank you very much. Thank you, Nicola. We finally got there. Thank you very much. Now go to item number 9, and as I'm the lead member for adults, I'd like to ask Councillor Blackwell if she could take this agenda item. No, thank you.
Thank you. So this is a report for the update on integrated health facility and adult care services by Darren and Debbie, but I presume, Sue, that you'll be presenting.
Yes, thank you. I'll move on with it. And yes, thanks to both Darren DeLint and Debbie Parrott for their input into this report. So the Integrated Health and Care Facility will enable health and social care multidisciplinary services, and they'll be provided locally to reduce fragmentation of care and improve patient experiences and outcomes. And this is really exciting, and I would, it is just a really innovative project, and I'm proud to be involved in it, although I haven't been around it for a while, for very long, sorry. Partnership working is working well. There are frequent meetings to share decision making, coordinated care planning, and proactive identification of multidisciplinary needs. And there's development of a joint working strategy and shared co-working. So the transition to Islands View, to update colleagues and members, the new residential care home will provide modern accommodation and closer access to clinical services, as anyone who's visited the home will see. And I know on the day that Duke of Cornwall arrived and some residents were wheeled round, I think mostly by Nicola, they were really delighted at what they were seeing and wanted to leap in there urgently. Capacity will remain the same as Park House. That's 12 places in all, but there is a continued and strong demand for placements. The transition has been delayed due to further work being required following the CQC inspection. It was in sort of a virtual look at, really, not so much an inspection in March 26, because the CQCs have really exacting financial regulatory standards. A revised application was submitted and huge amounts of work went into that, and we're awaiting an outcome and decision. So well done to absolutely everybody who got all of the paperwork and all of the requirements over the line. It was not a job for the faint-hearted. As many of you will know, the Isles of Scilly has a high proportion of older residents. We do have an ageing population, complex needs, demand for both residential and domiciliary care is increasing, and many individuals requiring high levels of support. So residential care at Park House is delivered on a 24-hour basis. This includes support with personal care. I'm hearing an echo. Shall I carry on?
Yes, just a bit louder if you can speak a bit louder.
Okay, all right. Support with personal care, clinical oversight, and emotional well-being, really important. So admission to residential care is prioritised, and that's based on assessed need, risk, and urgency to ensure that most significant needs receive timely support. Domiciliary care is in place to help individuals remain in their own homes, and that includes early assessment of needs, safeguarding, and personalised care planning, and our domiciliary support is tailored. So there are some key challenges and risks which members may already be aware of, at least to some extent. 50% of our current staff are agency workers, and that includes our registered care manager and our head of adult social care. Our residential care manager, we are looking at how we recruit to that post, because do we have a joint post over both facilities on the campus? And the head of adult social care, that role is already out for advert, which I think closes in a couple of days. And I do have some viable CBTs and have been having informal discussions with candidates. So I am hopeful. Of a recruitment. So current pay levels and housing availability, as we've just heard about, housing availability are creating challenges, but work is underway with HR to review pay and incentivise, and plans have been approved for Park House, which will be repurposed as staff accommodation. So the new care home will operate at full occupancy, and there's no current flexibility for respite or emergency admissions. And this will require continual reliance on mainland provision in the most urgent cases, and I know how problematic this is. Demands for dementia support are increasing, while Islands View will support mild to moderate needs. It can't meet the needs of more complex cases. Current capacity doesn't meet the expectations, and there is a waiting list. Potential for daycare at Islands View has been explored, and there is a need for this provision. While the benefits are clear at the current time, and it's just not viable under CQC requirements, and that's due to the limitations of space. Even in our new Islands View, the capacity is 12. So there's lots to celebrate here, a great deal in terms of a really innovative project, in terms of working together, in terms of partnership, in terms of the hard work that's gone into getting this project to this stage. But in terms of capacity but in terms of capacity, we are still struggling, and we will continue to struggle. Although I think the care needs that are met will be met wonderfully. Thank you.
Thank you, Sue. The new care home facility is very welcome on the islands, and congratulations to the team who are still working hard to bring it online for residents. It is lamentable to see that a daycare respite service will now not be met at Islands View due to lack of space. In a new facility, one would have expected to at least have a continuity of service rather than a loss. This service would allow respite to carers, ensuring people can stay out of residential care for longer, as well as providing a valuable income to the council. However, it is very encouraging to see a review of pay levels is being undertaken to enhance remuneration, and hopefully that will see an increase in permanent staff employment from the islands. Councillor Mumford.
Thank you. Yes, it's a shame that everything's been delayed, but I think we will finally get there. The registration has gone in, I believe. Nicola said that it had gone in, and let's hope that everything will be all right and we'll be able to get everybody moved up there as soon as possible. Daycare is another thing that we need to be thinking about, as you said. Where could we do it? And to find another premises, then it's got to be staffed, and it's all to do with resources, I expect, isn't it, Sue? But I think it is quite important to try and get somewhere for that.
I think that needs to be looked at as a separate exercise at this moment in time. Doesn't mean to say there will be an element of integration, but currently at Islands View there isn't the capacity. And you're right, it would require extra resources to get it up and running. But it is important, and I would certainly acknowledge it as important, and I know other colleagues would as well.
Yeah, thank you. That's it for me. Thank you.
Thanks. Councillor Marcus.
Yeah, thank you, Sue. Yeah, just looking at the corporate plan, our previous corporate plan, and one of the objectives was to complete the project. So I think we're well down the road of that. I think the whole project encompasses the workforce aspect as well, which will be a bit more knotty to get through, but I think will be will hopefully change stuff and give us good outputs. So congratulations to that. And one of the promises was about retaining on-island residential care. So I think it's really important that we're at where we are with the project. I think it needs to be celebrated. I think we need to manage carefully the comms around this as well, because there is, like I say, a change of service as well in terms of daycare and respite care. So the community needs to be aware that we are, as a council, are laser focused on trying to work out solutions for those issues as well. And I would support the officers, and within maybe a new corporate plan as well, making sure that we can find solutions or work towards solutions for those aspects, because that's what I think the community needs to hear.
If I could just come in there, Councillor Backwell. We haven't lost daycare because we haven't had daycare. There has been some changes in respite because we were found not to be compliant with CQC regulations, but I don't disagree with you. There are absolute projects that we should be working on to meet the needs of people from our islands.
Thank you.
Thank you. Councillor Gottick.
Thank you. Just to say that I was very pleased to note at 6.3 that we're actually recognising and reflecting how much the skill set of our carers has had to increase over the recent time, and that we recognise that they're now doing an extremely skilled job. And while they don't go into that area thinking that they're going to earn large sums of money, they should be properly and fairly remunerated. And I'm very pleased to see that we're keeping an eye on actually evaluating the jobs and the amount of reward that those skill sets should engender. Thank you.
Thank you, Fran. Councillor White.
Thank you, Lynn. Thank you, Sue, for presenting the report, and to Darren and Debbie for pulling it together. I think it reads as a good, frank assessment of where we are now. And thank you also to all the adult social care team for all their hard work that they've put into getting the new facility ready. It's fantastic to have this purpose-built facility on the islands, and I know we're all looking forward to moving Park House residents up there as soon as we possibly can. It's also very good to hear that all parties, from health and care professionals to partners, and most importantly, patients and those receiving care, are benefiting from the partnership working the facility was designed to foster. So it sounds like it's moving forward very well. And of course, the delays are disappointing, if inevitable, for a project of this size in such a remote location as ours. I do have some questions, some of which relate to possibly to decisions made before I became a councillor last May and before your own appointment, Sue. So apologies to all of those if some of these have been answered before. I do have to question why, when we had a blank slate before us, that the decision was taken to build a new care facility with the same capacity as the old one, when that wasn't sufficient for demand. Was it based on the number we have the capacity to care for in terms of our adult and social care team and staffing structure?
I think I'll have to defer to Nicola for that. Can I just say, though, add, as it were, Nicola and Nicola's directorate to the thanks that you've given. There is no doubt that there 100%. Is really great working together. So, and her staff have been pretty amazing.
Nicola.
Yeah, just in terms of how the numbers were derived, I think the plan for care at the time at which the original scheme was developed was to support people in their homes as long as possible, because that's where people want to be. So I think this facility needs to be seen alongside the domiciliary care offer, because that's where most people would like to stay for as long as possible. And that the Park House option, or the new integrated facility, was for those that could no longer be cared for at home. So that the feedback at the time, and I know Avril was around then too, to talk about what the demand and need were. There was a lot of discussion about the number of bed spaces and where that was the appropriate level. But that's the history to it, was that the idea was that most people prefer to have care in their homes where possible, and that this would just supplement that at the right time within people's lives.
Thank you, Nicola.
Thank you.
Any more questions? Councillor Dean?
Yes, I did. Sorry, I thought Councillor White had more, but yes, I'll go. Yes, thank you everyone for the report, and thank you for the new facility. It's all great. I won't repeat the talk about the daycare not being available, but going on from what Nicola just said about people wanting to stay in their homes, that's a massive issue. If people want to stay in their homes and there's no daycare provision, that makes that much more difficult. So that's clearly an issue, but we won't, labour the point there. There's my dad went into Park House years ago, and he had dementia, and he got quite seriously ill with his dementia, and it was a hugely stressful time when the adult social care team at the time were basically telling us that he had to go to the mainland, and we fought, very hard to stop that happening. And the staff who were in Park House at the time were fantastic and fought his corner as well. And he was able to stay here, and he went through the kind of difficult, angry, violent stage and came out the other end, much calmer and much easier to deal with. So when we're talking about dementia care and the risk of people having to be sent to the mainland, it scares me to death, to be honest, because it's a horrible, horrible position to be in, a situation to go through. So everything we can do to keep our residents on island, I think we need to. So I'll leave that there. And the other point, again, we've touched on it, but I find it really frustrating that we go round and round and round in circles about staffing. We talked about increasing the remuneration package for carers, I don't know, 4 or 5 years ago, maybe more, and we just go round and round and round, and we don't seem to ever kind of grasp it. And we're always talking about the additional costs of agency staff. We're also, Sue, you touched on it with children's services, having a permanent kind of structure at the top makes such a difference to kind of the continuity of the service and the capacity, the skill of the service as well. So I welcome everything that we're talking about to get the staffing better, but I think we need to do more, and I think we need to do it faster, because it's we've been talking about it for years. So let's try really hard. Anyway, I'll stop talking. Thank you.
Thank you. I think no more lights on. So the recommendation is that members are requested to consider and note the contents set out in this report. Do I have a proposer? Thank you, Councillor Marcus, and a seconder. Thank you, Councillor Mumford. All those in favour? Unanimous. Thank you very much, and I'll hand back over to Avril. Thank you.
Thank you very much. That's the last agenda item. So it's time to close the meeting. Thank you very much, everyone, for coming. And